Hello and welcome to this CPI Education Webinar Short. My name is Nuala Carroll and I'll be talking to you for the next few minutes about how we can bring a trauma-informed practice into our classroom. Now, whether you're a teacher, an SMA, Anna, principal, student or a parent, I hope that you will find something here to take away with you. The aims for this webinar are answering the questions of what is trauma. I'll be looking at definitions, examples and some statistics, particularly in relation to the Republic of Ireland. We also want to look at how trauma can impact the learning brain, and as staff, how can we support someone by using a trauma-informed approach in the classroom. Why does disruptive behaviour occur? I've taught in Irish classrooms for over 17 years in both mainstream, autism classes and in SEN. For the last 2 years, I've been delivering safety intervention training to school staff all around Ireland and abroad, as well as speaking at the Irish Primary Principal Network conferences both in November and February this year. I've had many discussions with staff that confirmed for me that my position was not unique in seeing an increase in distressed behaviour in the classroom and experiencing work burnout. I also read research from Mary Immaculate College in Limerick, who surveyed junior infant teachers in December 24. They reported 80% of their students were presenting with higher emotional and behavioural needs than in previous years. Why all these changes? Yes, we're seeing increased complex learning needs of students, as well as staff struggling with lack of staff, resources and training for schools. But what isn't discussed is trauma. And why would it? It's invisible. It's often accompanied by shame, so it's not discussed. It's rarely diagnosed, and yet it contributes daily to the stress students and then staff are experiencing in the classroom. So let's take a closer look. So what is trauma? There are many definitions. This one is taken from a government guidance published in November 22, which in it states that trauma results from an event, a series of events, or a set of circumstances that is experienced by the individual as harmful or life-threatening. There are three types of trauma. Our first is acute trauma. This can occur following a one-off event such as an accident, an assault, or a natural disaster. The second is called chronic trauma. This results from repeated and prolonged exposure to highly stressful events. And the third is complex trauma, resulting from repeated exposure to multiple traumatic or stressful life events that has long-lasting psychological impact on the individual. Now, when we are talking about trauma, you may also have come across the term ACEs, or Adverse Childhood Experiences. These are traumatic events that are experienced by individuals under 18, impacting on the learning and developing brain. So let's have a look at some examples of these in Ireland. Let's look at some of the research in Ireland. The World Health Organization began raising awareness of the impact of ACEs on a child and their lifelong health. Now, some of these would include physical abuse, sexual abuse, emotional abuse, neglect, presence of alcohol or substance misuse in the home, family separations, incarcerations, or suicide. Now, the research in Ireland is quite limited, but what we do have access to is data around our overall poor mental health, alcohol consumption, and history of clerical abuse. Now, one limited study done by the CAO in 2019 compared the presence of ACEs in Ireland versus the US, where we presented with 65% of that population presented with at least one adverse childhood experience compared to 61% in the US. Now, a similar study done in the UK by Professor Mark Bellis said that the impact of children who suffer from these traumatic experiences are at increased risk of poor educational outcomes, that they can develop poor health, social well-being across the lifespan. And for those who suffer ACEs in the home, exposure to further adversity in schools is likely to amplify this risk. However, schools can also be an opportune setting for children who lack safety in the home to recover from that stress and to build resilience. He talked about the importance that these children would have a positive childhood experience, and that it was really important that staff, if they used a trauma-informed approach, could support this. So let's look at some of those impacts on the learning brain as they present in the classroom. Effects of trauma on the learning brain. Neuroscientific research has demonstrated the impact of trauma on the brain, including changes to the sensory system, neural architecture, and neural circuits. There's also a growing body of evidence that trauma leaves an imprint, not only on the brain, but on the mind and the body too, signifying the need for a trauma-informed approach by staff. Now, for a student in a classroom, what can this look like? A child with one or more ACEs are more likely to be affected by stressors, past experiences of trauma. A signal is then sent to the brain that triggers a fight, flight, or freeze response. And depending on the student, you may see anything from extreme outbursts, walking or running out, overcompliance, silent crying, or extreme apathy. At this point of crisis, it's important for staff to be aware the student's thinking brain has shut down, so they will have difficulty hearing or understanding complex instructions. Their memory or ability to learn a new task will be affected, as well as their ability to focus their attention. In addition, you may see maladaptive coping strategies present here. Avoidance behaviors, escape or withdrawal, binge eating, self-harm, anger, daydreaming, emotional numbing or shutting down. As staff, when we see these behaviors, we can begin to recognize the presence of trauma. The child is having difficulty coping and needs trauma-informed support to help them de-escalate and feel safe. What is a trauma-informed approach? As staff, when we begin to understand trauma and recognize how it can present in a young child in the classroom, we want to make sure we get the support right. A lot of this is around reframing behavior and recognizing the presence of trauma. So as staff, how we view behavior, how we talk about behavior, the language we use to describe it will change how we then support the child as well. And even changing the question for ourselves, that when we see disruptive behavior, that we ask, instead of what's wrong with this child, what has happened to this child? Because what we are seeing is a child enter that fight, flight, freeze response, which tells us that the child doesn't feel safe. So a big part about being trauma informed in our support for children with trauma is recognizing the difference between safety and felt safety. So for a lot of us as staff and adults supporting children, we are constantly watching for their actual physical safety. However, a child's felt safety is their perception of feeling seen and heard, and if they feel safe in an environment, that can in itself help them then to regulate from that down, come back down and de-escalate from that fight, flight, or freeze response that we talked about earlier. So as staff, considering the complexities of need and ACEs, how do we get that support right? It is really important, firstly, as staff, that we listen with empathy when our students are trying to tell us and communicate any means possible, whether it's verbal or non-verbal, what they need in that moment to feel safe. It's important then as well that the child, if they actually are vulnerable enough to reach out and ask for that help, that they are met with a non-judgmental approach. Their fears or concerns or triggers are not dismissed as unimportant, and that they are included in the process of helping them to feel safe by being offered real choices. So as staff, this does require a certain amount of flexibility where we can offer some choices and include our student in that approach so that we get it right. We aren't mind readers. We aren't always going to know what they need in that moment to feel safe. But a lot of times, even after a crisis has passed, that we can go back and talk to our students, communicate with their communication preferences choice as well, and asking them as well, what can we do to help you feel safe? A lot of times their answers on that can really surprise us, and they can actually help us as staff to feel like we're getting that trauma-informed approach right. An important motto to remember, and again, we'll hear this an awful lot for communities with neurodivergence, autism, and anyone with disability. They always ask staff who are supporting them to remember, nothing about me without me. If we are trying to get support right for a student, that student should be involved in that process. So let us start communicating that a little bit more with our students to see how can we help them to feel safe as well as actually be safe in the classroom. An important part about using a trauma-informed approach is recognizing that we as staff and adults can support a student by creating the counter of an ACE, which is a positive childhood experiences listed below. This was hugely encouraging for me for after years of trying to support children who were living in very difficult situations, and I felt very limited in the ways in which I could support them. And if all the support I was doing wasn't actually having any real impact on them. What I've found in my research is that even temporarily creating a safe space for a child can reduce cortisol stress levels, can reduce the impact of the wear and tear of trauma on their physical body. And mentally, it can actually allow them to learn and experience success. It can give them, by including the child in their support and listening to their voice and offering real choices, the child can actually have a sense of control, which also is a very positive childhood experience for them. A big part of this support is the impact of the staff around them. When staff are self-regulated and they are a trusted adult for the child, this also creates another positive childhood experiences. For the child to be part of a social network within a school, a team, cultural traditions being recognised, using strength-based approaches, recognising the talents and skills within a child. All of these add up as stores minds for the child to have these lifelong experiences that they will take with them and can act as a counter to the presence of trauma as well. A big one of those in that list there, that visual, that even with trauma existing, a child can still flourish within a safe community. And a big part of that is the staff. So what I'd like to look next as staff, how can we be a self-regulation or co-regulation tool for a student with trauma? So am I co-escalating or co-regulating? Let's look into how we as the staff or adults can remain regulated and calm when our students are in distress. Dr. Leanne Johnson works with staff in schools creating awareness around trauma, and she talks about how children tune into our nervous system, that the calmer we are, the safer they feel. So staff well-being and their response are a big part of bringing a trauma-informed response into the classroom. On the next slide is a useful tool designed by Dr. Leanne Johnson for adults to use when supporting a child. As staff, we are human and we become distressed and we can become dysregulated ourselves, especially supporting a child with complex needs. So this is a good tool for staff to check in and see how we are doing when our student is in crisis. So to model and facilitate co-regulation, staff can check in for themselves and see which of these would be true for you in the moment. Am I co-escalating or am I co-regulating? Now, if I'm co-escalating, you might find that you are matching the child's energy and distress. You might ask yourself, am I reacting or responding? Am I using language that will escalate? Like calm down, stop shouting. Am I physically showing signs of distress with my body language, my tone, and my pacing? And a big one is staff who are so invested in our students. Am I taking their behaviour personally? If I am co-escalating, then let's look at what we can do to help us to co-regulate. And then we can move to the other side here and start looking at ways that we can co-regulate. The first one then is to check and see, am I modeling calm behavior? Am I speaking slowly and evenly? Am I breathing regularly? Am I asking why about their behavior? Can I offer a connection with that student before correction? And have I created a safe space for all of their emotions to feel validated? In looking through these, we can find ourselves and start moving toward that co-regulation, because as staff or adults, we are the thermostat in the room. We set the temperature. When we are regulated and calm, consistent in our communication, that student, it's going to help them to regulate with us. Remember, this is a slowly developing skill. We often expect children to be able to do this on their own, when in fact, up into our mid-20s, our brains are still learning to co-regulate. So having a trusted adult in the room that can help our students to co-regulate is a big part of getting a trauma-informed approach right. We have been talking about trauma, and just before I sign off, I would like to just remind you that if you've been impacted by what has been discussed here, please reach out to any of these support services that will be available to help you, whether you're a child, a parent, or a staff member working in schools. It's so important that we are aware of our own triggers, our own trauma, so that we can better support those in our care. This brings us to the end of this webinar. I hope you gained some insight into how to bring a trauma-informed approach into the classroom. If you'd like any more information on the courses we deliver, you can get in touch with the information on the screen. On the last slide, you'll see a link to a free resource with further information on trauma-informed care for educators. Thank you for listening. Goodbye.